Dr. Anthony Fauci is predicting Johnson & Johnson's COVID-19 vaccine will return Friday, but this time it's going to have some restrictions. The J&J vaccine was paused as a precaution after rare blood clots were found in a handful of people. Sharon Bajenda speaking to doctors and getting their take on a possible return.
That's a strange combination that we don't see too often, and that's something that needs a little more investigation, a little better understanding of whether it's related to the vaccine, and if so, what's causing it.
Area doctors say it's odd the blood clots are linked to low levels of clotting factors, but plan to follow guidance once a recommendation is reached. The CDC's Advisory Committee on Immunization Practices will meet Friday to decide what's next for the one-dose Johnson & Johnson vaccine.
We'll see what the FDA says, we'll see what the CDC says, but it seems that Johnson & Johnson is a very safe vaccine, an extremely effective vaccine, and very convenient.
While some vaccine hesitancy may develop after hearing the potential of blood clots, Dr. Ben Wesson says the J&J vaccine is a good tool in the fight against COVID-19.
One of the things that Johnson & Johnson is most effective for is populations that are hard to reach with 2 different shots.
Getting the vaccine and completing the vaccine, which is another challenge.
UW Health's Dr. Tellez Hiran, who serves as chair of the Latino Health Council, says the Latinx community is highly affected from COVID-19 due to the type of work they do. She says for some Latinx workers, completing a 2-dose series can be a hurdle.
Work in the factories and in the fields and in the stores. So the vaccine is going to be one more tool that we're going to have to help our communities.
Dr. Tellez Hiran says she hopes the pause doesn't create fear because for some rural communities, the J&J vaccine may be their only option due to storage issues.
We need to do a good job on informing people that is 1 in a million and that there are other things that we do in medicine that carry a higher risk.
It's nice to have that variety for patients to choose from, and it's also critical to have that one shot for patients that are hard to reach.
In the meantime, experts say get vaccinated with the 2-dose options to protect yourself.
There hasn't been evidence that there's any sort of concern with a substantial number of blood clots or anything like that with the Moderna or the Pfizer vaccines.
In Milwaukee, Sharon Bajenda, CBS 58 News.